Good afternoon. Good afternoon. My name is Dr. Velma Scantberry, and I am coming to you live at DPC Educational Center. And again, this is Dr. Scantberry, and I am here with Ask the Doctor Live. So for any of you who are on, please go ahead and let me know you're here. Good afternoon. Facebook Live. Dialysis Patient Citizens Educational Center. So good afternoon, Keith. Thank you for coming on. This is Dr. Scantberry, and I am the medical consultant for Dialysis Patients Educational Center. I'm here to answer your questions. If any of you have any questions about dialysis, transplant, or otherwise. As you know, we are coming into a new season for vaccination. This month, the CDC puts out a new updated COVID vaccine, and it is really recommended for all patients who are immunosuppressed. I think everyone over the age of 6 can get the new vaccine. There is the mRNA vaccines, which is Pfizer and Moderna, and there's also a non-mRNA vaccine called Novavax. So please be sure to speak to your doctor about getting your new updated vaccines if you are over the age of 65 and you're on dialysis. I recommend that you get your updated shingles vaccine. I think shingles is for those over the age of 50, and RSV has now been updated for those over the age of 65 or immunocompromised. And when you say immunocompromised, that counts for anyone who's had a kidney transplant or on dialysis. So generally for patients under age 65, we recommend that you get your everybody get their flu shot, as well as the pneumonia shot for those who are older. And you know, there's a different kind of flu vaccine for those less than 65 and those who are over 65 and those who are compromised, because we have a not so robust immune system and we're more likely to get infections. Those who are over 65 will need a high dose of a flu vaccine that's much different from those who are under 65. So if you go into the pharmacist, they will ask you in terms of the strength of the vaccine is different for those under 65 as well as those over 65. So as we get into this flu season as well as RSV, I do recommend that you get your updated COVID, get your flu, RSV if you're 50 and over, and shingles. If you've ever had a shingles infection, you will know that, or you know someone who've had a shingles infection, you'll know that it hurts a lot. And it can linger in the dermatome. It does attach to the nerves, and so it can lead to a lasting pain, neuropathy. So we do recommend that those who do not have a contraindication to get your shingles vaccination. It's a 2-part vaccine. The first one is given, and then the second one is given a minimum of 2 months later. You can get it at 3 months, you can get it at 4 months. So make sure you get updated as we come to the end of September. October is prime season for flu vaccines as well as updated COVID vaccines. And thank you all who have joined. My name is Dr. Scantberry. Thank you, Yolanda, for putting out information about DPC. And I want you to, if you are not yet a member of DPC Educational Center, please go online and sign up, because if you go to the website, you'll find a lot of additional information, helpful information online. At the web page, there's education about different kidney diseases. There are recipes. There are also updates in terms of different groups you can join for dialysis patients, transplant patients, even recipes in terms of what you can cook and healthy recipes. You can also learn how to be an advocate and join other DPC advocates in terms of being able to go to Washington, D.C. in terms of any legislative actions that are needed or need your support. So I encourage you to become a member of DPC Educational Center. Go to the website and sign up. So thank you all for joining. Thank you, Timothy. Thank you, Lynette, and Monica, those who are all watching. Let me know if you have any questions. One thing I was going to talk about is that I recently had a patient who was having trouble getting on a transplant list. And I want you to all remember, if you have someone who's waiting to get on a list, trying to get transplant, that you have options. You don't have to stay with one transplant center. You can multi-list, and you can list those centers that you're able to get to geographically. You certainly don't want to list 400 miles away unless you happen to have a relative that's there who will be able to support you during the transplant time and also post-op. Generally, transplant patients, after the transplant, they want you to hang around. Sometimes there are family house that you can stay in, or they may put you up in a hotel. So when you opt to get listed at a different transplant center, make sure that you have the availability to hang around for a few weeks to make sure that your kidney is doing well and you don't need any biopsies. But generally within your vicinity, there are different areas that you can apply to. So if I have New York is 2 hours away, so we know the New York list is very long. So some people in New York may have family in New Jersey. They can list in New Jersey. They can list in Pennsylvania if they're willing to drive back and forth. And for those who may live in Maryland, may want to list in Pennsylvania. So different options across the state lines depending on where you live and how close you are to another area. So just want to make sure you understand that you can double list and you can get evaluated at many centers. And what centers would do is they will send the information from one center to another so that you don't have to repeat all the testing. What are some of the reasons a patient do not want to transplant? That would be a good question for anyone who's on here. Generally, some patients feel like they don't want to, they're afraid of needles, they don't want to have the blood work done, they've heard bad things about it. Oftentimes, when patients in a dialysis unit see other patients go off to transplant, they may only hear about the bad experiences. They heard that someone died after their transplant, it didn't work, they had a bad outcome. Those things are rare. Remember that most patients, 95% of patients, will do well with the kidney transplant. Certainly, the longer you are on dialysis, the more complications you are likely to run into. For instance, the longer you are in dialysis, especially hemodialysis, the fluid in, fluid out can jeopardize your heart long term. And so many patients may have cardiac issues even if they go through the transplant. And that's why we put patients through to be seen by a cardiologist, making sure that they're able to tolerate all the medications, that sort of thing. So it's very difficult. Some patients may not necessarily not want a transplant. They may not qualify for a transplant. I've seen some patients recently in the last, say, 5 years, unfortunately, who had been told by their physician that they shouldn't get a transplant because transplantation was still experimental. That is not true. We have passed the experimental stage, and that's why it's so important to make sure you're well educated, understand the risks and benefits. And when I tell someone, before you decide not to get a transplant, come on in or go to a transplant educational session, get the information about the risks and the potential complications, and whether or not you're willing to now change your mind or whether you're still against it. But be an educated patient who are making the decisions based on facts and not hearsay. Certainly, longevity is better with a transplant than with dialysis. We know that 50% of patients, the older they get, the more likely they are to die on dialysis. And the number one cause of death for patients on dialysis is cardiovascular disease, heart disease. So you want to be careful if you're on hemodialysis. It's important to keep your fluid status at a minimum in terms of your fluid gains. The biggest concern that we have with patients is this: over time on hemodialysis, the more fluid you gain, the more likely you are to put more stress on your heart. And so over time, your heart does not work as well as it should be. So that's so very important to understand. It's important to know, and that's the importance of dialyzing, right? More often, if you're unable to keep your fluid fall, if you dialyze every day or 5 days a week, you are putting your heart at less jeopardy than if you're dialyzing 3 times a week. Certainly, those are the things we worry about. So if you have cardiovascular disease based on long-term diabetes or long-term hypertension, those things put your heart at risk, as well as smoking. So it's important to minimize the things that cause progressive heart disease. And we talked about phosphorus last month in terms of the amount of vessel disease, of buildup of calcium in your blood vessels, that may eventually cause a patient not to be a candidate because their blood vessels become rock hard and you're unable to make an opening to make a connection into the blood vessel in order to connect the kidney. So that's very important. Phosphorus control, keeping your calcium phosphorus metabolism optimal, and that's why we check those. You get checked on dialysis on a monthly basis. So I don't know, I put the question to the audience here, if there's anyone you know who does not want a transplant, and what reasons what reasons they have for not wanting a transplant, other than hearing the negative things, or they may have family members who did not do well on transplant. And also for some patients who have had recurrent disease even after their transplant. And I've had one young lady who had PGN, and she reoccurred first time, second time, within a short time after, and lost both kidneys, and she decided she didn't want to try it anymore because there weren't any newer medications that would give her a better hope for longevity for that kidney. So thank you, Danielle, for connecting from Puerto Rico, originally born and raised in New York. Thank you. Thank you so much for logging on. Appreciate you coming on, and I hope you have any questions. Be sure to let me know. So it's important to keep yourself in good shape, because one of the things that is important is when you get called in for a transplant, you want to be healthy. They want to know that your stress test is up to date, that you had your cardiac testing, that you had that colonoscopy that was due. So you want to make sure that you get all those things done. That's just about being healthy overall. And so it's important to understand that that those are the things that we look at. So welcome, Danielle, for Yolanda said, great to connect. And so thank you so much for coming in, Jennifer. Let's see, there was a question. Many patients are afraid while they're on dialysis. Can mental therapy help with this? Most certainly. I mean, certainly for people who know it's coming, it's still important to understand that many patients suffer from depression, just the fact that their life has changed. Now they're dependent on dialysis. They can't do the things that they used to do. They have to look for alternatives to go on vacation, whether it's peritoneal dialysis or hemodialysis. We have to recognize that those are changes in your life that's going to be important to recognize. You know, you may be suffering from anxiety, or you may suffer from depression. And it's okay. Those are treatable diseases. And yet there are conditions that we all don't like to talk about, but mental health is very, very important. This month it says September, I think it has to do with Suicide Prevention Month. And so we are always aghast when we hear of someone who commits suicide, because we didn't see it coming, or we didn't know they were facing those things. So it's important to seek help. Don't let yourself get to that point. Talk to your family members, talk to your friends, talk to your your co-workers. If you say, I just don't feel, I'm feeling down, I can be helped, I'm looking for some help. That's one of the reasons here in our office, in the medical office, we also have mental health therapists. And that is so very important to understand that that there's help out there. There's medications, there's therapy, and part of the information that you'll get on Dialysis Patient Education Center, you'll also learn about ways to deal with anxiety and depression, and that's common. It's so very common. Even after transplant, many patients don't do well because things are not going well. They have rejection after rejection. The kidney didn't work as well, and it's important to recognize that whether it's one-on-one therapy or whether it's group therapy, it's part of getting better, and it's part of survival. And don't feel like you should not be stigmatized. And so thank you very much for asking that question. Another question: what is the difference between the Nova vaccine and the regular COVID vaccines? Remember, Pfizer and Moderna came about as a result of the new mRNA vaccine, and so some people are reluctant to have this new technology, the new innovation of having a mRNA vaccine, because people feel it gets into your genes and it somehow causes an array of issues. And so the Novavax is not your is not your mRNA vaccine. It's a non-mRNA vaccine. And so what they do is they take the vaccine, as we did make vaccines in the past, and you inject it into a carrier, you collect the antibodies, and you give it back as a vaccine. So it's a non-mRNA vaccine, so it's important to realize that. Some people are willing to have a regular vaccine as opposed to the new mRNA vaccines that came about as a result of COVID. That is only given, the COVID mRNA vaccines, Pfizer and Moderna, can be given to ages 6 and over. The Novavax can only be given to ages 12 and over. So adults can also have it. That was just recently approved. It was not approved much. Thank you for that question, but you can always ask your pharmacist if they're carrying it. I know some pharmacists are limited. They may only have Pfizer, or they may only have a Moderna. So if you have a preference for one or another, check with your pharmacist and make sure that you get the one you wanted, not because that's all they have there. Basically, Pfizer and Moderna are interchangeable. You don't have to stick to one, but if you prefer to, that's fine. Traveling while on dialysis. Certainly, if you're on dialysis and you're traveling, you got to make sure, certainly with peritoneal dialysis, you just let your center know. They will send your fluid ahead of time to wherever you're going on dialysis for PD, so that it arrives there and you don't actually have to lug with all the stuff. So that's important to know. It's a lot easier for patients to do than for hemodialysis. On the other hand, you have to arrange to get dialyzed at a nearby hemodialysis center. So that takes a lot of planning and executing. You have to figure out where you're going, where the dialysis units are, and which ones will accept your transfer for that period of time, in terms of having a chair available, whether it's a week and you just need 3 times, whether it's 1 day versus 2 weeks. So those things need to be planned ahead of time. It's not like you can swap out and say, well, I think I was going to Miami and now I'm going to Fort Lauderdale. So you would definitely have to plan those things out. Hopefully there are still cruises that do allow for dialysis patients, where you can go on a cruise and dialysis occurs right on the ship. So it's always something to consider. It was present before COVID. I'm not sure if it's still available. So if anyone have any information about that, please put it in the chat so others may take advantage of these dialysis cruises. So it's certainly the way to go in terms of not worrying about where you're going to dialyze, and you can get off the ship when you want to. You cannot, if you don't want to, you can stay on board. So very good. Thank you so much, Daniel. I hear you're doing well. Was doing really great, active in the gym, dialysis, doing well. So thank you. Yolanda, thank you for joining the live session. Any more questions? Glad to see all of you are joining. Again, I am Dr. Scanterbury. I am the medical consultant for Dialysis Patient Citizens Educational Center. And one of the things someone asked a question about Epogen, and I just had a patient who got admitted to get a blood transfusion because she was reluctant to get certain injections, which is really just given on dialysis. So it's important what happens. Epogen is a manufactured hormone, which is substitute for erythropoietin. Erythropoietin is the hormone that's made by your kidneys. And what erythropoietin does is that it causes your body to make more hemoglobin, and so keeps you from being anemic. That's one of the functions of your kidneys. As you develop kidney disease and your kidneys are no longer working, you are unable to make enough Epogen, and so anemia is a common side effect of renal failure. So patients may see the creatinine getting worse and worse, but sometimes some patients become so very anemic before the doctors realize that it's coming from kidney failure. So it's important while you're on dialysis, you're usually given Epogen to make sure that your hemoglobin stays above 9, which is where they like, most of the time. And if there are other alternatives to Epogen by different manufacturers, but the goal is to keep you from being severely anemic. And so your dialysis unit should be keeping up with what your hemoglobin is and keep it under control by giving you the Epogen or any alternatives while you're on dialysis. If you are on PD, generally you go to the unit to do it once a month, depending on what your regimen is based on what your numbers are and how often you need it. So you never want to get so low with your hemoglobin that now it's critical, 7 or below, and now you're needing to have blood transfusion. Because with every blood transfusion for any patients who is thinking about kidney transplant, you want to be careful because you can actually form more antibodies from blood transfusion. So if you need to have a blood transfusion, make sure that you tell your nurse to make sure they ordered irradiated blood and unfiltered, so that they use a special filter to keep you from forming antibodies. So thank you very much for that question. What foods should be avoided after transplant? Generally, some patients after transplant have issues with, it can be potassium, but a lot of that is related to the immunosuppression, which some of them can cause hyperkalemia. So initially, we would tell you to be careful with your phosphorus with your potassium. We certainly want in the early phase, if you had high blood pressure before transplant, it may not be as severe after transplant, but you still also have to watch your salt intake because it was there before you had the new kidney. You don't want to make your blood pressure worse, even though you have a new kidney. So basically, it all depends on what your numbers are and what that new kidney is able to clear. If it's clearing phosphorus very well, almost too well, many patients will need to take supplemental phosphorus because now the kidney is clearing it. If it doesn't clear potassium as well, then we may need to limit your potassium. And so those are just some of the things. Mostly is keeping up with the numbers. Generally, magnesium is too low. We have to supplement you with magnesium. But the biggest thing of what you should avoid, generally for some of the immunosuppression, such as cyclosporin or tacrolimus, you want to avoid grapefruit or star fruits. Those are things we don't recommend because it interferes with the metabolism of the metabolic cycle of the immunosuppression and can alter your levels. So those are generally the big things we say avoid because oftentimes there's a lot of issues with potassium. They may say avoid orange juice until we can get it under control, or not eat as much, not take in as much. So sometimes potassium is an issue, but we do avoid, for most patients, we tell them to not use grapefruit because that will interfere with your immunosuppression particularly. Is severe nausea common after dialysis every time? A lot of it may have to do with the fluid balance, how much fluid that you have to take off. And so the more fluid you're having to remove, the shifts of fluid in your body may often lead to nausea. So that is something that you may want to adjust, or if it's constantly there, with even whether it's minimal fluid or a lot of fluid being released. If you're taking out 2 liters versus if you're taking out 5 or 6 liters, that's a lot of fluid. If you think about that, 5 kilos, so that's important to know. You may want to ask for some anti-nausea medication before dialysis, so you can make it through dialysis without having a severe nausea or even vomiting. Jimmy Owens says, hi, I've been on dialysis about 13 years now. Symptoms, not sure what your symptoms are as symptoms of dialysis, but you can answer that question. No symptoms, never threw up or anything. Okay, great. So some of it depends on your tolerance and what you've had or fluid. So thank you so much for answer. 5 days a week. Wonderful. I'm glad you're on home dialysis. That is wonderful. We are all in this together. Thank you very much. And so I appreciate all of you being here. Although I thought you were supposed to do 7 days a week home dialysis unless you have kidney transplant. Different people, depends on how much fluid you need to remove and how often some people can do 5 days, some people can do 6 days and skip 1 day. All is okay to do that. You can do it 7 days if you're doing small amounts. So certainly the more you do it, the better your body is, and so you can decide what works for you. Some people may need to, because of the fluid volumes or the heart, in terms of how much they need to take off on a daily basis, and they keep the intake and the fluid volumes down, then they may be able to do 5 or 6 days and may not necessarily need 7 days. It's very much important to talk to your doctor, and it's really about your fluid volumes and you're getting rid of all those metabolites. Some people don't take a lot of fluid, so they don't need to take off a lot of fluid. So it's really according to your nephrologist and your recommendations that they give you. When my fluid comes out of my body, generally the fluid, some people will still pass urine liquid via the bladder. The kidneys may still put out fluid, but remember, you're not getting rid of metabolites. And so the goal is really to cleanse your body and get rid of the waste products, meaning that the fluid that you're excreting, even though you're on dialysis, is not getting rid of the waste products. And so it's not useful fluid, but it does help in your overall fluid balance. If you continue to make urine or make liquid while you're on dialysis, it allows you to then be able to take more because you're having some kind of output. If you have no output, the only other way that you would, be able to get rid of fluid is if you're exercising, sweating it out, ways to be able to dissipate fluid from your body. So when it's important to, in terms of your fluid status, making sure that you have trouble. Most people have trouble breathing or anything like that while they're waiting for the next dialysis treatment. You want to make sure that your fluid isn't accumulating in your lungs. Some people fluid may accumulate around their body, and others in their legs, where nothing in your chest. So you know how your body is able to handle the extra fluid. So thank you very much for that. So I appreciate all of you being here today. Very great questions, good participation. And I encourage you to join again. Go to the website, DPC Educational Center, and become a member so that you are able to keep up with not only our Facebook, but our Instagram Live, and be able to take part in the many different opportunities to learn more at the various webinars and educational sessions that are put on by our team. So thank you very much for being here. It's been a wonderful 30 minutes, and I hope to see you next time. So Take care, God bless, and enjoy the rest of your day.